హలో వెల్కమ్ టు లిటిల్ స్కాలర్స్ రేడియో. నేను మీ ఆర్జే సంప్రీతి రెడ్డి. ఈరోజు మన రేడియోకి ఎవరు వచ్చారో తెలుసా? డెంటిస్ట్రీలో ముందుకు వెళ్తున్న మోస్ట్ ఎక్స్పీరియన్స్డ్ అండ్ క్వాలిఫైడ్ డాక్టర్ మేఘన గారు ఫ్రమ్ ఆర్కే చిల్డ్రన్ అండ్ డెంటల్ హాస్పిటల్. సో గుడ్ మార్నింగ్ మ్యామ్.
Hi Sampriti, good morning. Thank you for having me here today.
మ్యామ్ ఫస్ట్లీ హ్యాపీ నేషనల్ డెంటిస్ట్ డే.
Thank you.
మ్యామ్ మీలాంటి మోస్ట్ ఎక్స్పీరియన్స్డ్ డెంటిస్ట్ మా రేడియోకి రావడం మాకు చాలా ఆనందంగా ఉంది.
Thank you for having me. I'm also excited for this.
మ్యామ్ మీరు ఈ ప్రొఫెషన్ ఎందుకు చూస్ చేసుకున్నారు? దీని వెనకాల ఏదైనా కారణం ఉందా?
As a matter of fact, to be honest, dentistry was not my first choice. As like every BPC student, I wanted to be a medical doctor only. But back then we had MSET. That was our entrance exam. So during the entrance exam, because of like some family situation, I was not able to get into a medical college. I had a very narrow miss, and that's how I got into dentistry. I'm an undergraduate from Usmania Dental College, and I've done my post graduation in SVS. So that's how I got into dentistry.
మ్యామ్ మీ మీ ఎక్స్పీరియన్స్ ప్రకారంగా మోస్ట్లీ ఎలాంటి టైప్ ఆఫ్ డెంటల్ ఇష్యూస్ వస్తుంటాయి?
80% of the children and adults, they'll have dental caries, and we have conducted many dental camps till now. Mostly in children, what I have seen is they don't brush properly. So they have more of calculus and tartar buildup, cavities, and children around the age group of 10 to 12, or like say around 8 to 12, మోస్ట్లీ దే విల్ హ్యావ్ ఇంజురీస్. అంటే ఆడుకునేటప్పుడు కింద పడిపోవడం, లేదంటే స్కేట్ చేస్తూ కింద పడ్డామని వస్తారు. అలా దే విల్ హ్యావ్ ట్రామా టు ది ఫ్రంట్ టీత్, ఫ్రాక్చర్ ఆఫ్ ది ఫ్రంట్ టీత్.
మ్యామ్ టీత్ని హార్డ్గా బ్రష్ చేయడం వల్ల అది స్ట్రాంగ్గా ఉంటాయని అంటూ ఉంటారు. దీని మీద మీ ఒపీనియన్?
టీత్ హార్డ్గా బ్రష్ చేయడం వల్ల ఏమవుతుంది అంటే, దే సంథింగ్ కాల్డ్ as enamel on the top surface of your teeth that gets eroded away, that gets washed away, and it cannot be replaced again. So whenever you brush, you have to brush with a soft bristle brush. You have to brush for around only 2 to 3 minutes will be sufficient, and brushing hardly doesn't suffice your needs. You have to brush on the front surface, on the back surface, and all the surfaces of the teeth, not just the surfaces which are seen on the outside. And brushing in a good technique is sufficient than brushing hardly. If you brush hard, it doesn't make any difference. It only worsens the case.
సో మార్కెట్లో చాలా టైప్ ఆఫ్ టూత్ పేస్ట్ వస్తుంది, కానీ మెనీ ఆఫ్ దెమ్ ఎవరికి తెలియదు ఎలాంటి టూత్ పేస్ట్ వాడాలో. మీరు ఏమైనా సజెస్ట్ చేస్తారా?
This is a question that actually most of the patients ask. So you will have a variety of toothpaste in the market, as you said. Um, for children below 6 years of age, you should look something called as fluoride content. Fluoride is something that helps to fight your cavities. At the same time, if there is excess amount of fluoride either in the water or in your toothpaste, what happens is it starts to stain or put marks on your permanent teeth. So for children below 6 years of age, you have to, we advise toothpaste having a fluoride content of around 600 ppm. If there are more cavities, and in younger children also you see a lot of cavities, for those people we advise something around 1000 ppm. But usually for kids, it is, you have so many varieties like Colgate Kids or Pediflor. All these contain fluoride content of around 600 ppm. That should be sufficient for them. Whereas for adults, usually you can use any toothpaste, but herbal toothpaste usually have a lot of abrasive agents. So they tend to wear away the enamel. That will do more harm than protecting your teeth. So I don't recommend personally herbal toothpaste. You can use anything like Colgate, Close-Up, Pepsodent. Herbal toothpaste like Meshwak, Patanjali, or Dabur Red, they contain more of abrasive agents. So I personally don't recommend them.
మ్యామ్ సమ్మర్ అనగానే అందరికీ గుర్తుకొచ్చేది ఐస్ వాటర్, ఐస్ క్రీమ్ ఎక్సెట్రా. కానీ ఐస్ వాటర్ తాగేటప్పుడు చాలా మందికి పంటిలో జువ్వు అనే అనే ఫీలింగ్ వస్తుందిగా, దీని వెనకాల కారణం ఏంటి?
So basically, teeth will have three layers. One is the enamel, dentin, and the pulp. Whenever these eye substances or the cold substances get into your dentin, they start to sensitize your nerve endings, and that is how you feel the sensitivity. So, whenever there is wearing away of the enamel, you will start to feel that sensitivity.
మ్యామ్, మాలాంటి వాళ్ళకంటే స్టూడెంట్స్కి మీరు ఇచ్చే అడ్వైస్ ఏంటంటే ఎలాంటి డైట్ తీసుకుంటే మన టీత్ స్ట్రాంగ్గా ఉంటాయి?
So, I'm not a dentist who says don't eat chocolates or don't eat sticky foods or junk foods. Once in a while, it's okay to have to give yourself a little treat. కాకపోతే ఏంటి అంటే వాట్ ఎవర్ యూ ఈట్, ఇదర్ అ చాక్లెట్ ఆర్ అ పిజ్జా స్లైస్, ఎనీథింగ్, యూ హ్యావ్ టు rinse your mouth thoroughly so that the food doesn't stay much longer in your mouth. The reason for cavities మెయిన్గా ఏంటి అంటే ఫుడ్ నోట్లో ఉండిపోవడం వల్ల ఇట్ విల్ స్టార్ట్ అట్రాక్టింగ్ మైక్రో ఆర్గానిజమ్స్, అండ్ దట్ ఈస్ హౌ యువర్ దీస్ మైక్రో ఆర్గానిజం విల్ స్టార్ట్ టు ఈట్ అవే యువర్ టీత్. సో దిస్ is how the decay process starts. So you have to just make sure that the food is not staying longer in your mouth.
మ్యామ్, చాలా మందికి నేను అబ్జర్వ్ చేసింది ఏంటంటే చాలా మందికి ఎల్లో టీత్ అవన్నీ ఉంటాయి, మళ్ళీ బ్యాడ్ స్మెల్ వస్తుంది టీత్స్ నుంచి. సో దాని వెనకాల ఏదైనా కారణం ఉందా?
Actually, what I have noticed also, like it is particularly among the teenagers, you will have these yellow teeth and bad breath, bleeding gums. All this is because you're not brushing properly. Mostly children and also adults also, what they try to do is they only try to brush the teeth on the outer side, whatever only the people can see, only they want to brush it on that side and they don't want to brush the inside of the teeth. So that is one reason. Lack of proper brushing is the only reason why teeth are turning to yellow color. That is because of the tartar buildup. That is not, the tooth itself is not yellow. It is the outside, like dirt, that is being accumulated on the teeth. That is the reason teeth are yellow. This is one reason. Bad breath is because of this, and then later you will have gum problems and periodontal diseases. All these are because of this.
చాలా మంది అంటుంటారు టీ ఇంకా సమోసా బెస్ట్ కాంబినేషన్ అని. కానీ టీ ఈస్ ఎక్స్ట్రీమ్ హాట్ అండ్ సమోసా ఇస్ ఫుల్లీ మసాలా ఫుడ్. సో ఇట్ విల్ ఎఫెక్ట్ అవర్ టీత్ ఆర్ వాట్?
Um, so basically, tea is a hot beverage. Yes, we all like comfort foods during a rainy season. So it's okay to have tea once in a while, but tea ఏం చేస్తుంది అంటే it's very hot, and as I said, when there is wearing away of the enamel, then it will start to sensitize your teeth. The dentin will accumulate the stains also from the teeth, and that is how your teeth starts to discolor. That is in one way tea and your these tea and coffee will start to affect your teeth in that way. And having a hot beverage as such is nothing wrong. So as I told you, you have to take care of your enamel first. That is the only way you can keep your teeth healthy. Whenever there is chipping away of the enamel or loss of enamel, then you will have the tooth problems.
Ma'am, as your endodontist specialist, most of them don't have a root canal treatment. Can you please explain about that?
So, me and my husband, both of us are endodontists. Endodontists are root canal specialists. As I told you, teeth will have three layers: enamel, dentin, and pulp. Once the cavity enters the pulp, there is nothing that we can do except you'll have two options. Either you have to extract the tooth or you have to save the tooth. If you want to save the tooth, what we do is a root canal treatment. So, root canal treatment is we pull away all the nerves from the tooth, and then we seal the whole tooth, not only just the upper part that you see. Inside there will be roots. From the roots we start the filling, and then we close it off in the top layer also, and then we suggest a crown or something such as an overlay, so it will protect your tooth. Root canal అయిపోయిన తర్వాత ఏమవుతుందంటే బ్రిటిల్ అవుతుంది, సో ఇట్ ఈస్ మోర్ ససెప్టబుల్ టు ఫ్రాక్చర్. ఇన్ ఆర్డర్ టు అవాయిడ్ దట్ వి సజెస్ట్ అ క్రౌన్ ఆర్ అన్ ఓవర్లే.
మ్యామ్, చాలా మంది లేవగానే బ్రష్ చేయకుండా బెడ్ కాఫీ అని అవన్నీ తాగుతూ ఉంటారు. అదేమన్నా వాళ్ళ హెల్త్కి ఎఫెక్ట్ చేస్తుందా?
Okay, regarding this bed and breakfast thing, actually, there are different schools of thought regarding it. It is like a controversial question that you have asked. Few until like Western countries, what they do is they have their breakfast and their coffee in the morning, and then later they brush. So it is like after eating, you're brushing. So all the microorganisms get washed away, and that is one school of thought. And the other one is overnight you'll just close your mouth and sleep, or you'll be in a sleep. So నీకు saliva అనేది తక్కువ ప్రొడ్యూస్ అవుతుంది. Microorganisms will be most active at that time. Uh, so there is another school of thought that suggests, so as soon as you wake up, you have to freshen up and you have to rinse your mouth and you have to brush your teeth and then have your food. Food is something that is going inside your body, so it should not go along with the microorganisms, and that is another school of thought. And I would suggest, obviously, to brush your teeth and then eat something.
మ్యామ్ చాలా బుక్స్లో ఏంటంటే బ్రష్ ట్వైజ్ ఎ డే అని రాసి ఉంటుంది, కానీ చాలా మంది అది ఫాలో కారు. దానివల్ల వాళ్ళ హెల్త్కి ఎఫెక్ట్ అవుతుంది, ఓరల్ హెల్త్కి.
Okay, brushing twice a day is, as you said, it's a textbook thing, and it has benefits its own ways. If at all you're not able to brush twice a day for any reason, nowadays we have so many different gadgets in the market. Like water flossers are one thing that actually I personally use. So instead of brushing at night, you can use the water flossers, I guess. So it can be a substitute to your brushing, normal regular brushing. Instead of regular brushing, you can use your water flossers at night and brush once a day. Even that's fine, I guess.
మ్యామ్ సాధారణంగా ఒక బ్రష్ని ఎన్ని డేస్ యూజ్ చేయొచ్చు, అంటే మ్యాక్సిమం టైం పీరియడ్ ఫర్ బ్రష్?
You can use a brush up to 3 months at a time. After 3 months, you have to discard it and use a new one. If not, at least when you see fraying of the bristles, అంటే నీకు bristles అనేవి distort అయిపోయినప్పుడు, you can see the change in the shape of the bristles, then you have to discard it and use a new one. You shouldn't just you keep using it like years together. I've seen many patients doing that. So that what it does is it doesn't do its job. It won't remove the food particles from your mouth effectively if the bristles are not in the good shape.
మ్యామ్ మన గ్రాండ్ ఫాదర్స్ వాళ్ళందరూ వేపాకుతో వేప పుల్లతోని బ్రష్ చేస్తూ ఉంటారు కదా, దానికి గల రీజన్ ఏంటి? వాళ్ళ టీత్ని స్ట్రాంగ్గా ఉంచుతుందా వేపాకులు?
ఒకటి ఏంటి అంటే ద డిఫరెన్స్ బిట్వీన్ ఆర్ ఎల్డర్ జనరేషన్ అండ్ అస్ ఇస్ ఫుడ్స్. మనం వి కన్జ్యూమ్ లాట్ ఆఫ్ రిఫైన్డ్ అండ్ ప్రాసెస్డ్ ఫుడ్స్. అప్పట్లో ఇట్ వాస్ నాట్ లైక్ దట్. ఇట్ వాస్ మోర్ like raw foods, and they didn't contain much sugars or preservatives. So there is a change in the food habits. Previously they used to brush అంటే వేప పుల్లలు అవి యూస్ చేసేవాళ్ళు. వాళ్ళకి ఎక్కువ క్యావిటీస్ ఉండేవి కాదు. దట్ ఈస్ బికాస్ ఆఫ్ ది ఫుడ్ హ్యాబిట్స్. కానీ ఇప్పుడు వీఆర్ consuming more of the processed foods. We cook so much and we eat lot of sugars. We consume so much of drinks, sticky foods. ఇవన్నీ దే డోంట్ వాష్ అవే విత్ మన వేప పుల్లలతోటి అవి పోవు. సో ఇన్ దిస్ జనరేషన్ వీ హ్యావ్ టు యూస్ అ టూత్ బ్రష్ అండ్ అ టూత్ పేస్ట్.
మ్యామ్ ఈ డెంటిస్ట్ డే సందర్భంగా మీరు మా స్టూడెంట్స్కి ఏదైనా అడ్వైస్ అండ్ సజెషన్ ఇవ్వాలనుకుంటున్నారా?
Okay. Regarding oral health, what I would suggest is brush twice daily, morning and night before you go to bed. And I don't know what you call Gen Z kids or whatever. You try to use school gadgets and everything like to show off or whatever. But electric toothbrushes are in the market, and many of them have asked me regarding these electric toothbrushes. They are not like you shouldn't use them, but they are actually designed for people with less manual dexterity. Um, so just use a normal regular toothbrush instead of an electric brush, because in the long run it will cause sensitivity. So it is like a bit of damage to your teeth. So avoid that. And regarding the food habits, you can have anything that you like, as I told you before also. Just rinse thoroughly and try to add healthy foods in your diet. that is not only for the oral health but also for the overall well-being of you as a person. So that is another one. Mm, and visit your dentist regularly, I'd say.
థ్యాంక్ యూ మ్యామ్. సో దిస్ ఈజ్ ఆల్ అబౌట్ టుడే. మనం ఈరోజు మేఘన మ్యామ్ నుంచి చాలా ఇన్ఫర్మేషన్ గ్యాదర్ చేసుకున్నాము. మరి ఈ రోజు నుంచి అవన్నీ మనం కూడా పాటించాలని కోరుకుంటాం. సో మ్యామ్, ఎట్ లాస్ట్ కెన్ యూ సజెస్ట్ ఎనీ ఇన్ఫర్మేషన్ ఫర్ అవర్ చిల్డ్రన్?
Thank you, Sampriti, for having me today. And I was really excited doing this with you. I loved all this time being with you. Thank you so much for this. And I would like to mention that I am a dentist by chance, but I'm an endodontist by choice. I really like my profession. I love what I do. And uh, every day you get to meet with different types of cases, and so it's always exciting for me. And I really love the job that I do. I love bringing smiles to the people. I love relieving the pain. So this is about me and my profession. And lastly, the one thing that I would suggest to all the children is, in your life, just trust your gut instinct and go with it. And regarding your oral health, don't neglect it, and don't try to do something cool, or don't try to do something just because you have to look cool in front of your friends. I have seen many children doing this. They start it around your 13s or 14s. What they try to do is they try to open cola bottles with your teeth. Stop doing that. Don't do it. Once your teeth are gone, they're just gone. They won't come back to you again. And the other thing is maintain your oral hygiene properly. It's like the gateway to your body. So if there is a good oral health, it will reflect you in your overall well-being as an individual, and it affects your whole body health. So take care of your health. Health is something that once you start losing it, you won't be able to bring back that. If you lose your health, it's like you have lost everything. So have a good health, have a good oral hygiene, visit your dentist or your doctors regularly.
సైనింగ్ ఆఫ్. దిస్ ఇస్ ఆర్జే సంప్రీతి. డూ ఫాలో లిటిల్ స్కాలర్స్ రేడియో.
వింటూనే ఉండండి, వినిపిస్తూనే ఉండండి మీ లిటిల్ స్కాలర్స్ రేడియో.